A very good morning, everyone. I, Assistant Professor Sharayu Pravin Rathod, welcome you all to the sixth day of 1 week International e-FDP ESTP on empowering pharmacy education, navigating regulations, global trends, and advancing outcome-based education and research under the aegis of IQAC in association with APTI. It's an absolute pleasure to welcome you all to today's session. We have gathered here for a stimulating discussion, and it's an honor to introduce our esteemed guest speaker for this occasion. Our first speaker for today is Dr. Bibhas Chandra Mohanta, sir, Assistant Professor at the Central University of South Bihar, Gaya. Today, Dr. Mohanta will be speaking on the topic Global Perspectives of Pharmacy Education and Practices, a subject that is incredibly relevant in today's world of evolving healthcare and pharmacy practices. Dr. Mohanta has an impressive academic and professional background. He completed his PhD from Behrampur University, Odisha in 2020. Prior to that, he earned his M.Pharm from the Department of Pharmaceutical Sciences, Dibrugarh University, Assam in 2010, and his B.Pharm from Behrampur University, BPUT, Odisha in 2004. With over 14 years of teaching experience, Dr. Mohanta has been a valuable member of the academic community, serving in prestigious institutions as an assistant professor and associate professor. He currently holds the position of assistant professor in Department of Pharmacy, School of Health Sciences at the Central University of South Bihar. He is also serving as the assistant proctor at the university since February 2024. Dr. Mohanta is not only a dedicated educator but also a passionate researcher. He has successfully supervised one PhD thesis and currently has another ongoing. He has been invited as a PhD thesis adjudicator at esteemed universities like Osmania University and JNTU Anandpur, contributing his expertise to the academic community. Beyond teaching and research, Sir plays a vital role in academic publishing, serving as an editorial board member and reviewer for journals from esteemed publishers like Elsewhere, Springer, Taylor and Francis, and AAPS Farm SciTech, among others. Highlighting the impressive achievements of Dr. Mohanta sir, Sir qualified GATE exam in 2007 and GPAT in 2014. Sir was awarded with the Best Participant Award in 2017 in AICTE-sponsored 2-week FDP program at JNTU Anandpur. To top it off, Sir was awarded the Best Faculty Award during the 13th Foundation Day celebration of Gokhale Group of Institutions, Pobli, Andhra Pradesh in 2014. An active contributor to scientific literature, Dr. Mohanta has published 3 patents, 20 research papers, 7 review articles, and contributed to 15 book chapters. His work has earned him recognition globally with citations exceeding 323 on Google Scholar and an H index and I-10 index of 10. We're truly fortunate to have someone with such extensive knowledge and experience share their insights with us. Let us all welcome Dr. Bibhas Chandra Mohanta sir with a warm round of applause. Thank you, Dr. Mohanta, for being here with us today. We look forward to an engaging and insightful session. Now, without further ado, I would like to request Dr. Mohanta sir to please take over and start the session.
Thank you very much, madam, for introducing me. Good morning, everybody who are present here. My respected principal sir, vice principal sir, other faculty member, and my dear students and other participants. So today I'm going to present my topic that is global perspectives of pharmacy education and practices. Sir, madam, can we make it full screen mode? Okay. So means I'll discuss that overview of international trends, challenges, and innovations.
Sir, is there a problem?
Yes, my Slide is not means properly. Is it visible?
Yes, sir. The slides are visible. Could you just go into presentation mode? Could you go into presentation mode? Yes, sir. The slides are now changing.
But next slide, I am unable to progress.
Pardon, sir.
Means if I will go to third slide, it is not going.
Uh, could you like click on the third slide over there on the left hand side? We'll try to see if it's working or not.
No, sir.
Uh,
May I share this PPT to you, sir?
yeah, that is also fine, sir. Also, you can do one thing. I can see that that you have shared just your PowerPoint
Yes, yes.
presentation onto StreamYard. So if you share your entire screen onto the StreamYard platform, then I guess that will not be an issue. Then you'll be able to change your slides.
But I am sharing already. I have shared. No?
No, so you have not shared your entire screen. You have only shared the PowerPoint application. That is why it's not going in the presentation mode and the slides are not changing. So if you could just go on the present option over there, share screen and entire screen, then you'll be able to share the entire screen.
Sir, is it visible now?
Okay, sir, this is also visible. Could you change your slide?
Yes, yes. Now it
Yes,
is
sir. Yes, it is going.
possible,
It
sir.
is working.
Okay, sir.
Yes. Thank you,
Sir,
sir.
sir. It's good, sir. Thank you, sir. So, first of all, I have to discuss means I have to tell about the pharmacy education and practice. So, pharmacy education refers to the structured academic and professional training required to prepare individuals for career in pharmacy, including coursework, clinical training, and licensures. However, pharmacy practice in other sense, if we will see that, it involves the application of this education, means pharmacy education in various healthcare settings, focusing on medication management, patient care, and public health. So, if next is importance of pharmacy in global healthcare system. So, pharmacists, we know generally that plays a crucial role in healthcare by ensuring safe and effective use of medication, improving patient outcomes, as well as reducing healthcare costs. So, means they are contributing to public health initiatives, vaccination programs, chronic disease management, and as well as pharmaceutical research, making essential in global essential themselves in global healthcare system. So, overview of my presentation means I'll cover global pharmacy education systems, key pharmacy practices, the role of pharmacists across different countries, challenges faced in pharmacy education and practice, emerging innovation, and future trends shaping the field. If regarding the educational system, that global pharmacy educational systems, so we'll cover about the means Western countries like US and Canada, European countries, and Asian countries, as well as South African countries. So means in United States of America and Canada, generally PharmD programs means they're requiring for the practice of pharmacy. So students to complete Doctor of Pharmacy PhD PharmD program, which typically takes 4 years post undergraduate studies. So after earning a PharmD, graduates must complete a residency programs for specialized training, followed by licensure exams such as NAPLEX. NAPLEX means the North American Pharmacist Licensure Examination, and other regional jurisprudence examination. So, if we go to European countries, so generally there is a diverse systems with integrated master programs. Pharmacy education in Europe varies across countries, but generally follows an integrated master program, predominantly MPharm program model. Many European nations offer 5 or 6 years Master of Pharmacy MPharm degree, which includes both academic coursework and practical training. And graduate must complete internship and pass national and regional licensure examination before becoming licensed pharmacy. So means after completion of the course, means they have to pass one licensure examination as means 2 years back that PCI has approved that exit exam, similar to exit exam. That European country, they have a separate examination for licensed pharmacists. So those who will qualify in these exams, they can only practice the pharmacy. So European and another thing is that European Union allows some other between members through mutual recognition agreements. So difference between UK, Germany, and other European countries. So in UK, what are the means educational systems, and in German, what are the educational system, and other European Union countries. So that we'll discuss now. So in United Kingdom, typically a 5-year integrated MPharm program, followed by 1-year pre-registration training and General Pharmaceutical Council, that is GPHC exam. So strong focus on, so means in United Kingdom, that 5 years integrated MPharm program, that is means focus on clinical pharmacy and patient care, and pharmacists are heavily involved in prescribing and medication management. But in case of Germany, that then require a state examination, that is stats examen instead of an MPharm degree. So require a recognized pharmacy degree, proficiency in German B2 or C1 level. So means if you have that degree also, pharmacy degree also, you can't practice unless you have a proficiency in German language. You have to pass, that is B2 or C1 level, and may need to have your qualification evaluated by German authorities potentially requiring additional exam or training. So education involves three phases in Germany: university studies, practical training, and state exams. So greater emphasis on industrial and research-based pharmacy role. So in German, they have, they are giving more emphasis on industrial and research-based pharmacy roles. But in case of in other European countries, many follow Bologna process, but with variation in curriculum length and focus. Some countries emphasize community pharmacy, while other prioritize industrial and regulatory roles. So licensing requirements vary across countries, making international mobility a challenging despite Bologna harmonization. So Bologna process in Europe and its impact in pharmacy education. See, the Bologna process, it's a higher education reform initiatives in Europe, which is aimed means for standardizing and improving educational quality across countries. So it established a 3-cycle degree systems, that is bachelor's, master's, and doctors. So impact of Bologna process on pharmacy education includes a shift towards competency-based education, increased student mobility through recognition of qualification across European nations. So generally, through this Bologna process means uniformity in the their curriculum, their pharmacy degree curriculum will be there, so that students can mobilize from one European countries to another European countries, because they have some like in our India, that PCI has framed a syllabus which is implemented throughout the India, that is uniform throughout the India. So similarly, that European countries also, they have as per the Bologna process, they have a uniform syllabus which is implemented throughout European nations. So that that students can mobilize from for their qualification or for their practices from one European countries to another European countries. So enhancement of pharmacy curricular with an emphasis on clinical training and research skills. And the process of the process promotes international collaboration and prepares pharmacists for diverse healthcare environment. So this is the impact of Bologna process, that the Bologna process promotes international collaboration. So means that European country can collaborate with other countries, other countries, other foreign countries, and means they can prepare the pharmacist for diverse healthcare environment. So means in various diverse condition, means how the pharmacist can work, that things that can also be means that can be trained through this Bologna process, because Bologna process will help them to train them that how they can work in various diverse conditions. In Asia's variation and degree structure like B Pharm, Pharm D, and M Pharm programs are there. Pharmacy education in Asia exhibits significant variation across countries. So you know that many countries such as India and Pakistan offers bachelor degree as entry level degree, while countries like Japan and South Korea, they have transitioned to the Doctor of Pharmacy Pharm D model. So they have that Japan and Korea have adopted the Pharm D model, whereas India and Pakistan they have adopted the B Pharmacy model. Additionally, some countries provide a Master of Pharmacy programs for advanced specializations. The structure and curriculum of pharmacy educations are evolving to meet global accreditation standards and enhance pharmacist role in healthcare system. Going to the African and Latin America. So developing pharmacy education with increasing standardization. So pharmacy education in Africa and Latin America is developing with increased standardization. Many countries are transitioning towards competency-based education and align their curricula with international accreditation standards. So in Africa, initiatives by African Pharmaceutical Forum and the WHO World Health Organization aim to enhance pharmacist training and clinical practice. So they have taken that African Pharmaceutical Forum or APF and WHO both they are working to enhance the pharmacist training and clinical practice. Similarly, Latin America is working towards harmonized pharmacy education, with several countries adopting PharmD programs and improving regulatory framework. However, challenges such as resource limitation and access to quality training persist. So in Africa, that is the means they're facing some challenges like resource limitation. Already I've told you that resources are limited, and that quality training means is also somewhat means lacuna is there, or somewhat means scarcity is there. Uh, Coming to the international accreditation and standard. So the International Pharmaceutical Federation, as we know that FIP, and World Health Organization, who plays a critical role in shaping pharmacy education and practice worldwide. Both organizations work towards the harmonization of pharmacy qualification, mobility of professionals, and enhancement of pharmacy's role in global health initiatives. So both FIP and WHO both are working in that means directions, how to means improve the means pharmacy, the quality pharmacist means their skill, how to improve their skill of the pharmacist, and in other global health initiatives they are taking. Role of International Pharmaceutical Federation, FIP. So FIP sets global competency framework, accreditation guidelines, and professional development standards to ensure consistency and quality in pharmacy education. So similarly, that WHO is also playing a major role. So WHO plays a significant role in promoting and standardizing pharmacy education and practice worldwide. So WHO also collaborates with government and international organizations to strengthen pharmaceutical education and ensure access to quality medicines. So it initiatives supports workforce development through policies that integrate pharmacists into healthcare system, particularly in low income countries, by enhancing training program and providing technical guidance. So mainly that who there means working in low income, there means giving financial assistance and as well as means supports to low income countries like means African countries. For means by providing means a training program and various technical guidance also they are providing, along with the financial support. So partnership with organization like International Pharmaceutical Federation, FIP, and United Nations Development Program, UNDP, help in policy making and global health advancement. So means already we know about the UNDP and FIP. So means World Health Organizations means collaborating with this or with the help of this FIP and UNDP, they are means framing various policies, and they're means helping policy making and global health advancement. So collaborative efforts have led to the improved medication safety, antimicrobial stewardship, and greater pharmacist involvement in public health services. So due to this collaborative effort of this WHO, FIP, and UNDP, so means we are getting benefited in means various forms like they're leading improving medication safety, and they're working in towards this antimicrobial stewardship and greater pharmacist involvement and public health services also. So global pharmacy practice, as we know that means various means pharmacy practice are there like hospital pharmacy, community pharmacy, industrial pharmacy, regulatory affairs, and research and academia. So hospital pharmacy, that is clinical roles, medication therapy. So those who are working in hospitals, so they are mainly focusing on their clinical role, medication therapy management, inpatient care, and collaboration with healthcare teams for optimizing drug therapy outcomes. So means these pharmacies, that hospital pharmacies, are collaborating with the that physicians and other means healthcare teams for optimizing drug therapy outcomes. So coming to the community pharmacy, so means that community pharmacists are engaging themselves in patient counseling, means they are counseling the patients and prescription services, they're dispensing prescription drugs, over the counter medication guidance. So, they're suggesting the patients regarding the use of that medications, what are the they are giving some additional information like drug interaction, or means how they have to take the medications. So they are suggesting, or they are giving advice, to the patients. And they are also their health screening, they are also involving themselves in the health screening. Suppose sometimes that medical teams are coming to screen that leprosy patients in a particular area, or tuberculosis patients who are or AIDS patient. So they are involving these community pharmacies are involving in this sector also. Next, coming to the industrial pharmacy. So industrial pharmacists are, as we know, that they're engaged themselves in drug development, production of API, production of your various dosage form, as well as quality control and regulatory compliance. So next, coming to the regulatory affairs. So those the pharmacists who are working in regulatory affairs domain. So they are just seeing they're making the policies. They're uh, engage themselves in the drug approval, pharmacovigilance, ensuring medication safety and efficacy, and compliance with international regulatory frameworks. So pharmaceutical research and teaching and contribution to innovation in drug development, healthcare policies. So role of pharmacists in different countries. So if we see about the what is the role of pharmacists in various countries, that the developed countries like US and Canada, European countries, and Asian countries. So what is their role, that we'll discuss. So in US and Canada, there means one type of service is there, that pharmacist-led clinics. So pharmacists in both United States and Canada have expanded their roles, offering patient care services such as chronic disease management, medication therapy optimization, and minor ailment treatment. So medication therapy management clinics. So in these clinics, that pharmacists provide medication reviews, adjust doses, and improve adherence. So sometimes that those who are suffering from the cardiac diseases, like hypertension or something, so those are sometimes being adjusted. So that is the role of that means in US and Canada, that pharmacists are providing that work they are doing, that they are adjusting the dose, as well as they are review the medications also, periodically they review the medications, and they are also engaged in chronic disease management. So pharmacists help manage conditions like diabetes, hypertension, and asthma. Minor ailments clinics. Some states of US and Canada, they allow pharmacists to prescribe medication for conditions like UTI, allergies, and cold symptoms. So there also collaborative practice agreements in US and Canada. So in many states, pharmacists work alongside physicians to prescribe and manage medication. So we know that in European, in US, that pharmacists are also managing they're prescribing medications. So in collaboration with the physicians, they are prescribing the medication, that which medicine has to be taken by the that patients. They are doing that work also, doing that job also. So apart from that, they're providing immunization services like vaccination. They have vaccination authority. So pharmacists in all 50 states of US can administer vaccines, including flu shots, COVID-19 vaccines, and travel vaccines. So moreover, that pharmacy-based immunization programs also they are running. A large chain like CVS, Walgreens, and Walmart provide accessible vaccination service. So emergency preparedness. So they are involved. They are also engaging. Their pharmacists are engaged in emergency preparedness also. During COVID-19 pandemic, pharmacists were essential in vaccine distribution and administration. So coming to the United Kingdom, they have independent prescribing authority as well as a supplementary prescribing or collaborative model also. So independent prescribing means independent pharmacist prescribers can handle a variety of cases from minor ailments and chronic disease management such as diabetes, hypertension, asthma to managing polypharmacy in complex patient cases. This role helps to alleviate pressures on general practitioners by providing an alternate route for patient care. So means they are independently means as I so told you that some pharmacists have independent prescribing means authority. So already I told you that they means for the minor elements and chronic disease management they have the independent prescribing authority. So in that way they means the workload of the general practitioners or physicians can be minimized. So apart from that, they have supplementary prescribing or collaborative models. So supplementary prescribing is a collaborative practice where the pharmacist works in partnership with a doctor or another independent prescribers. So this model is particularly useful for managing patients with long-term conditions who have an established clinical management plan. So clinical management plan outlines agreed treatment strategies and parameters within which the pharmacist can adjust medication. This arrangement ensures that while the pharmacist has flexibility, the overall treatment strategy remains consistent with the patient's broader healthcare needs. So you see that in supplementary prescribing or collaborative model, already I told you that they are working means with the doctors or sometimes another independent prescribers. So they are preparing a clinical management plan. So in that clinical management outlines that agreed treatment strategies already I told you and parameters that pharmacy can adjust medications because they have some clinical management plan. So in that clinical management plan outlines means within that one only within that range that pharmacist can adjust any type of medication. So Asia and Middle East, if you see that community there, so most of the pharmacists are working in means working as a community and clinical pharmacy and public health preventive care also. They are engaging themselves in public health preventive care. So in community and clinical pharmacy, so there most of them are means dispensing medication and their counseling, participating in health in medication therapy management. Coming to the public health preventive care, the pharmacists they are engage themselves in immunization programs. They are involved in health education and promotions. So mostly on topics such as nutrition, disease prevention, and response and their responsible use of antibiotics, how to use antibiotics. So they are awareing, they are giving health education or health tips to the public or to the patients. So African and Latin America, this is more or less like Asian countries. So, but they have very limited access, and there is a growing role in public health. So, coming to the challenges in global pharmacy education and practice. So, what are the challenges that things we'll discuss? So, first challenge is standardization of pharmacy curricular worldwide. The process of creating uniform educational framework, accreditation guidelines, and competency standards across different countries to ensure consistency in pharmacy training and professional qualification. So already, I told you one challenge is standardization of pharmacy curricular worldwide. Means it is difficult to have a common curricular throughout world. So that is that this process, that standardization process, that is means in that the process of uniform educational framework, accreditation guidelines. So we are unable to make a what accreditation guidelines as single accreditation guidelines which will be implemented throughout the world, or single educational framework which will be implemented or effective throughout the world. So it is very difficult. It has not been done till now. So standardization facilities international mobility of pharmacists and improves the quality of pharmacy education globally. So coming to the regulatory difference and licensure requirements. So pharmacy licensure requirements vary significantly across countries, affecting international mobility and practice rights. So different nations have unique regulatory framework, varying examination and distinct continuing education mandate. Some countries require extensive clinical training and standardized exams, while others have more flexible pathways. So harmonizing these regulations is a challenge, but essential for global pharmacist mobility and practice standardization. Third is technological advancement and digital health integration. So integration of technology in pharmacy is transforming education and education as well as in practice. So innovation such as electronic health records, you know that, and telepharmacy and automated dispensing systems enhance efficiency and improve patient care. So digital health tools like mobile health applications, artificial intelligence driven medication management, and blockchain of drug traceability are reshaping the pharmaceutical services. So these advancements allow pharmacists to provide remote patient counseling, monitor adherence to therapy, and optimize medication therapy management through data analytics and personalized healthcare systems, healthcare solutions. And fourth challenge is shortage of qualified pharmacy professions. So the demand for pharmacists is increasing globally, but yet many regions face a shortage of qualified professionals due to factors such as inadequate training capacity, migration of skilled pharmacists to higher income countries, and lack of incentives for pharmacy graduates to enter clinical practice. So this shortage impacts healthcare delivery, limiting access to essential pharmaceutical cares, especially in rural and undeserved areas. So addressing these issues requires investment in pharmacy education, workforce planning, and policies that support retention and professional development. So means another challenge is ethical concerns and pharmaceutical industry influence. So ethical challenges is in the pharmaceutical industry generally include conflict of interest, aggressive marketing tactics. So as we know that nowadays various that what pharma companies are there, and they are means engaging means themselves in a aggressive marketing tactics, so that who can get more means profit, or who can means capture the market. So there is a competition. You means and in that cases, what they are doing, so they're generally practicing some unethically. And apart from that, high drug price means, suppose one companies have a that patent, so that company, their means, or some company has having, suppose a particular drugs which is means in the patent period. So they themselves, they're selling the drugs in a high price, because there are no other players in the market. That is, we can say, that is their monopoly. So that is also unethical practice. And concern over biased clinical trials. So that is also means another problem in this pharmaceutical industries, that biased clinical trials. So the influence of pharmaceutical companies on prescribing practices and regulatory decision raises concern about prioritizing profits over patient well-being. So as we know that that pharmaceutical companies are spending money for giving or for practice for the physicians and other healthcare uh, healthcare that providers to prescribe their particular medicines. So in that way, so that is also not a healthy practice, that is unethical. And that sometimes they're managing the regulatory decisions for getting means approved of their product. So unethical pharmacy practice requires transparency, adherence to evidence-based guidelines and regulatory oversights to ensure patient safety and equitable access to medication. Coming to the innovation trends in pharmacy education, so online and means what are the means innovation and trends in pharmacy pharmacy education across globe. So there is a online and hybrid learning models. So means online and hybrid learning models integrate digital platforms with traditional classroom based education, allowing students to assess coursework remotely while still engaging in hands-on training. These models enhance accessibility, provide flexibility for working professionals, and facilitates global collaborations among pharmacy educators and students. So another is your simulation-based training and virtual reality. So simulation-based training uses technology to replicate real-world pharmacy scenarios, allowing students to practice decision making in a controlled environment. Virtual reality further enhance this experience by immersing learners in realistic stimulations such as compounding medication, interacting with virtual patients, handling emergency situations. So these models improve clinical skills, reduce errors, and provide a safe space for experimental learning without risk to real patients. Third is your competency-based education and continuous professional development, that is CPD. So competency-based education focus on ensuring pharmacy students acquire the necessary skills and knowledge through practical application rather than time-based learning. So continuous professional development, that is CPD, ensures that practicing pharmacists engaging in lifelong learning to keep up with advancement in the field, maintain competency, and improve patient care. Coming to the global pharmacy collaboration and exchange program, so international partners enable knowledge sharing, student and professional exchange programs, and joint research initiatives. These collaborations fosters cultural competency, advance pharmaceutical research, and improve pharmacy education through exposure to diverse healthcare system and practices worldwide. Coming to the global pharmacy practice future trends. Now that pharmacy practice means that future trends is that shifting towards patient centered care. So movement from traditional dispensing roles to direct patient engagement. Pharmacist plays a crucial role in medication therapy management, adherence counseling, and chronic disease management. So expansion of pharmacist-led services such as vaccination, health screening, and medication reviews. So integration of pharmacists into multidisciplinary healthcare teams to improve patient outcomes, and adaptation of personalized medicines and pharmacogenomics to tailored treatment to individual patients. Second is expansion of pharmacist role, that is vaccination, chronic disease management. So pharmacists are now administering vaccines including flu, COVID-19, and travel-related immunizations. So active participants in chronic disease management, including diabetes, hypertension, and asthma control also. So pharmacists also provide lifestyle counseling, medication adherence support, and collaborative care with physicians. So increased involvement in public health initiatives and preventive care services. Next is integration of technology in pharmacy practice. So implementation of electronic health records, EHR, to improve patient data management. So use of already means, as we know now, it is means era of artificial intelligence. So we can use this pharmacist can use the artificial intelligence for drug interaction analysis and personalized medicine recommendation. Another is telepharmacy services, expanding across expanding access to remote and undeserved areas. Similarly, automated dispensing systems enhancing medication safety and efficiency, and mobile health application aiding in medication adherence and patient education. So another is your blockchain technology, so that ensures secure pharmaceutical supply chain management. Uh, Artificial intelligence and automation in dispensing and medication management. So artificial intelligence and automations are revolutionizing pharmacy practice by improving efficiency, accuracy, and patient safety. So automated dispensing systems reduce medication error, while artificial intelligence-driven algorithm supports clinical decision making by analyzing patient data and predicting potential drug interaction. So additionally, robotic pharmacy systems enhance inventory management, optimize drug dispensing, and streamline workflow in hospital and community pharmacies. So telepharmacy solutions powered by artificial intelligence enable remote consultation, medication adherence tracking, and personalized treatment recommendations, further advancing digital health integration in pharmacy practice. Expansion of clinical roles in pharmacist prescribing. So pharmacists are increasingly taking on expanded clinical roles, including prescribing medications, managing chronic diseases, and providing direct patient care. In several countries, pharmacists now have independent and collaborative prescribing rights. Means already we discussed in that US and means UK, allowing them means they have the independent as well as collaborative prescribing rights. So allowing pharmacists to initiate and adjust medication therapies. So this trend improves access to healthcare, enhance medication management, and elevates the burden on physicians, making pharmacists key players in multidisciplinary healthcare teams. Coming to the next point is personalized medicine and pharmacogenomics. So means the rise of nowadays, you know that we are means already I have told you that we are going for means that individualization therapy means a particular patient means he or she needs that much drug or that things only means we have to give. So now as we know that in India, suppose I am suffering from fever and my weight is suppose 78 kilo, so I am taking 650 milligram of the paracetamol. And in that same cases, if suppose fellow whose weight is around 50 kilo, he is also taking the 650 milligram of paracetamol. So actually, in Western countries, they are means engage themselves in that individualization therapy. So in that cases, what they are doing. So how much drug is, means required for a particular patient, that much amount of the drug only means can be administered to that particular patient. So the rise of personalized medicines tailor drug therapies to individual patients based on their genetic profile. So that is pharmacogenomics. Or as we know that pharmacogenomics is a branch of personalized medicines, studies how genetic difference affect drug metabolism and response. So as we know that means based on their means ADME and that things, we are administering means drugs to a particular patients in case of personalized medicines or individualization therapy. So means as we know that genetic difference generally affecting drug metabolism and responses. So we have to means now we are means thinking about over means that particular topic that we are checking we are means based on that genetic means we are going for the pharmacogenomics study. So this advancement helps optimize medication efficacy, reduce adverse drug reactions, and improve patient outcomes. So pharmacists play a key role in implementing pharmacogenomic testing and guiding therapy decision based on genetic insights. Coming to the next is your sustainable pharmacy practice and green pharmaceuticals. So generally, in these cases, that they're emphasizing environmental friendly pharmacy practices and waste management. So pharmacists are increasingly involved in promoting environmentally friendly practices in medication productions, distribution, and disposals. So as we know that green pharmaceuticals means all we know about the green pharmaceuticals, which aim to minimize the environmental impact by reducing pharmaceutical waste, improving drug manufacturing process, and encouraging responsible medication disposal. Additionally, pharmacists play a role in advocating for eco-friendly packaging and sustainable supply chain management in the pharmaceutical industry. Coming to the conclusion, pharmacists are vital to ensuring healthcare consumers receive safe, quality treatment and education about their care journeys. So the global landscape of pharmacy education and practice is continuously evolving to meet the increasing healthcare demands and advancement in pharmaceutical sciences. While there are significant variation in curricula, regulatory framework, and practice models across different countries, a common goal remains to produce highly skilled and competent pharmacists capable of contributing to patient-centered care, medication management, and public health. Collaboration between academic institutions, regulatory bodies, and professional organizations is crucial in standardizing and enhancing pharmacy education globally. So, integrating innovation teaching methods such as digital learning and in interprofessional education can help bridge gaps in knowledge and skill across different regions. So, additionally, embracing a competency-based approach ensures that pharmacists are equipped with the necessary clinical, ethical, and technological expertise to address emerging health challenges. Furthermore, the expanding role of pharmacists in healthcare system worldwide, ranging from traditional dispensing role to clinicals, research, and policy making positions, underscores the need for continuous professional development. So, strengthening global partnership and adopting best practices from diverse regions can lead to a more harmonized and effective pharmacy professions. Ultimately, a global perspectives on pharmacy education and practice foster knowledge exchange, innovation, and improved healthcare outcomes. By addressing the disparities and leveraging advancement in the field, the future of pharmacy holds great potential to enhance patient care and public health worldwide. So with this, I am concluding my presentation.
लिंक झाल्या Thank you so much, sir, for that insightful and thought provoking session on the Google perspectives of pharmaceutical education and practices. Your expertise and comprehensive approach have truly expanded our understanding of the challenges and opportunities in this field. We are grateful for the valuable knowledge you have shared with us today, and we now have a deeper appreciation of the global dynamics shaping the pharmaceutical education and practices. I would now humbly request you to accept this certificate as a token of appreciation.
Thank you very much, madam, for giving me this opportunity.
Thank you once again, sir, for your time
Thank
and
you,
for
madam.
enriching our learning experience.
Thank
We
you, madam.
hope to have the pleasure of hosting you again in the future. Thank you,
Thank you,
everyone,
madam.
for being a part of this session. Thank you. Thank you so
Thank you, madam.
much.
Thank you.